What's going on, everyone? Happy Tuesday. Hopefully everyone is doing well, staying safe, healthy, and testing negative for all of those viruses that can make us sick. It is time now for the Tuesday edition of the Virus Update for Tuesday, December 9th, 2025. If you're new to my channel, welcome to my channel. This is where I do the Virus Update almost every day on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, but not enough news and information is going around to keep you informed. That's what I do here on my channel. Want to stay informed? Subscribe to my channel down below. If you like today's video, give it a thumbs up. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. Already, we have a ton of things to get through today. So many things that I actually just stopped and paused on searches because, well, there's already far more than enough things here. And the video would just go way too long. All right, starting off with this update from Mike Horger, PMC COVID update for December 8th, 2025. We probably won't read the whole thing, but we're going to read some of this. And we do have some very high and moderate COVID levels to talk about. First off, Arizona is listed now at very high. Vermont is now coming in at high as well, and Indiana too. You're also in the high categories. You can see that here in the red on the map, and then you do see very high in Arizona, but again, there is limited data out of Arizona at this time. Moderate for Nebraska and Alabama. Data only go through late November, and levels often increase following Thanksgiving. So the data that comes this upcoming Friday, that's going to be more important data that we see. And already we are seeing things go up. 1 in 102, or 1% of the U.S. population, is estimated to be actively infectious at this time. PMC COVID update December 8th, 2025. State-by-state estimates. Part 1. Arizona is very high, where only one online wastewater site is working at this time, or the only wastewater sites are in the Yuma area. Indiana remains high at this time. Michigan and Mississippi have considerably uncertainty at this time. Yeah, another areas, bunch of areas actually in the United States that don't have enough wastewater sites at this time. DC is still exceptionally low. I'm just going to randomly read some of these and take a look at this. DC, very low. 1 in 5,777 are actively infectious. I don't know if there's no data there. I don't know what that's all about. That's really strange. Maine, 1 in 73 people are actively infectious. The Northeast region as a whole, when it comes to COVID, is starting to go upward. Michigan is 1 in 87 actively infectious. Very low in Florida at 1 in 494. And taking a look at some other states, Vermont, 1 in 35 is actively infectious. That's high and almost very high at this point. Nebraska, 1 in 45 are actively infectious. Pennsylvania, 1 in 89 actively infectious. The state of Washington, 1 in 184 actively infectious. Oregon, very low there, 1 in 150. Data through late November showing transmission with no major pre-Thanksgiving celebration. That was some good news. Today may be the last day of 2025 below 500,000 new daily infections. That's an estimate from wastewater. So, yikes, that's starting to go up. Weekly infections remain around an estimated 3 million, likely to result in 1,000 excessive deaths. And it looks like this week, just based on estimate, long COVID cases resulting from new weekly infections, 147,000 to 590,000. And it also says here excess deaths resulting from new weekly infections, 900 to 1,400. Yikes, that's a really high number. Large and frequent gatherings increase risk of exposure. Stay home if symptomatic, and test before gatherings to reduce exposures. Vax, mask, and clean air to reduce the risk that exposures become infections. So this is straightly from him. I'm not personally telling you to vax. As you know, we have a you do you policy here on the channel. In relative terms, current transmission is higher than about half and lower than about half of the days since the onset of SARS-CoV-2. And let's just fast forward down here. This Friday, we will see that transmission increased in early December, and we're headed into a wave, likely scenario of what's going to happen, or we're headed on an atypical lower trajectory. And take a look here. You can clearly see here his model is projecting that things will continue to go up. Will we hit 1 million infections with this wave? I don't know. Right now, it looks like the medium of his estimate is in the 700,000 range somewhere. Let's see, is there anything more here? Yeah, the model currently has transmission. Okay, never mind. Let me correct myself. Peaking at 1.1 million infections on December 27th. There is substantial uncertainty this far out. Yeah, I would agree with that because we don't know. Is BA.3, .2 eventually going to do something? We honestly don't know that at this time. Alrighty, moving on now to the Queensland Weekly Respiratory Surveillance Report for December 2nd to December 8th. This is in Australia from Dennis the COVID Info Guy. Unfortunately, reported cases of COVID have gone up 336. That's up by 16.6%. Influenza continuing to rise. We've been seeing that spring surge over there. And matter of fact, it already is summer there. What am I saying? Spring? Yeah, this is not good whatsoever. 1,898 new influenza cases reported. That's up by 23.4%. RSV, 370 cases. That's down by 5.1%. COVID hospitalizations are stable at 40. Influenza, 72. That's down by 1.3%. RSV, 30. That's down by 14.2%. And we do see when they do the variant sequencing, NB.1.8.1 is 47% of the cases. KP.3.1.1 is 24%. XFG is 15%. And BA.3 is 14% of the cases there at this time. Now moving on to this from Dennis the COVID Info Guy. A landmark study shows COVID-19 isn't just a cold. One infection can cause long-lasting immune damage, and those with heart disease lost up to 70% of key immune cells. Reinfections may worsen it. The message is clear. Protecting ourselves still matters. Yeah, there's a lot of data that shows that just one infection of COVID can really mess you up and cause long-term issues. Alright, we also have this from Dennis the COVID Info Guy. For the first time this century, child mortality is likely to rise. For the first time in 25 years, child mortality rates for preventable diseases are projected to increase after having declined for 25 years. And there are many different reasons for that. Measles is back circulating. Flu at the moment a little bit more severe. RSV hitting kids hard. Long COVID, on and on I could go. Norovirus has been going bonkers lately. Yeah, there may be a new variant of norovirus out there. I don't know. You'll see here later in the video. Norovirus, at least in the United States, is really starting to get up there at this time. Speaking of new, there's a lot of news. Here's another new. New hybrid Mpox strain identified in England. Experts say the key concern now is whether events like this will alter the virus's transmissibility or yeah, not good whatsoever. This is said to be kind of a mix of the older and newer strains. And we don't know a lot about this just yet, but apparently things have been increasing when it comes to Mpox over in the UK. So that is not good, and it's something we'll have to keep an eye on. We'll have to start checking in when we do the UK day, which is going to be Thursday. As of right now, I don't know. Maybe we get to that Friday. But when we do the UK, we'll have to check up on Mpox. Alright, speaking of the UK, we also have this. If it comes up, there it is. UK critical incident declared in 2 of their Midlands hospitals. So, yes, 2 hospitals there are currently dealing with big-time problems. Both Royal Stroke University Hospital and County Hospital Stafford have been under severe and sustained pressure for the last week, with even greater demand over the weekend. Yes, flu season is really bad there. RSV has been going up. A lot of things are going up, and COVID is not one of them there just yet, but flu is the biggest problem, and it's really putting pressure on the hospitals in the UK. Unfortunately, a sign of what's to come here in the United States. We're already seeing it starting to take place here in the United States because things are really starting to get bad in a hurry. Now taking a look at what's going on in Mesa, Colorado. This is Mesa County, Colorado. I hope I said that correct. Someone correct me if I'm wrong down below. 5 norovirus outbreaks have been reported in Mesa County as winter season brings increased risk. Yes, norovirus is really taking off at this time here in the United States. And we're going to take a look at wastewater in just a little bit where Yeah, norovirus is bad. There's a lot of things bad in wastewater. Now to Iowa we go, where a school district in southern Iowa has canceled classes Tuesday and Wednesday due to illness. Yes, 30% of the students and staff are out. Many of them have influenza A at this time. All right, continue on. We still have more news. Yes, we're over 10 minutes already. In Detroit, Michigan area, well, Michigan in general. Actually, no, it says Detroit here. Hospitals tightening restrictions during cold and flu seasoning. Oh, yes, how about this? With cold and flu season upon us, visitor policies at some Detroit hospitals are being tightened. The Detroit Medical Center's new policy goes into effect Monday, December 8th, including the Children's Hospital of Michigan. Patients are allowed up to 2 visitors at one time. Kids ages 12 and under are not allowed on inpatient hospital floors or in observation units. And I'll be honest with you, I really agree with this because kids, we're watching the UK. Kids are getting hit really hard in the UK right now, and I think that's going to come here. Plus, let's read the following. Last year, the state health department reported 14 pediatric flu deaths, the highest number recorded in a single year since the state began tracking it back in 2004. So I think a little bit of prevention can go a far way, but unfortunately we do have the other problem. Kids go into school, and I'm not saying, oh, he wants school shut down, he wants mandates, this, that. I'm just saying we could be in for some real problems with schools because I think all these viruses are going to hit schools hard now and, well, heck, after Christmas, January going into February, we saw so many school outbreaks last year, and I think it's coming once again. All right, moving on now to this. Flu and other respiratory viruses are on the rise in New York and New Jersey as some hospitals mandate masks once again. Yeah, it's actually happening, believe it or not. I thought I read yesterday the UK over, the United Kingdom is also going to potentially be doing that in the hospitals. All right, here's some New York State data in this little excerpt here. With the week ending November 29th, the state's health department confirmed a total of 14,506 flu cases, an increase of 80% from the previous week. Again, that's from New York State, bringing the season-to-date total to 32,769 cases with already 1,743 hospitalizations. We have the rest of this month to go. We have January yet to go. We have February yet to go, and to some degree, March and into early April as well. Yikes, these numbers are going high in a hurry. And this is not good. According to the New York State Department of Health, as of last Tuesday, the flu was declared prevalent. Additionally, the state reports 13 respiratory outbreaks in hospitals and 15 respiratory outbreaks in nursing homes, bringing the season total to date already 220 outbreaks of viral respiratory illnesses. Yikes, that's just not good whatsoever. Moving on, we do have another news story. Department of Health, and I actually forget what state this is, South Carolina. Okay, this is measles news. Department of Health reports 27 new measles cases in upstate South Carolina, bringing that outbreak total to 111. That, my friends, is a very, very big increase. That is not good whatsoever. Okay, taking a look at what's going on with the Walgreens page here. Just real quickly taking a look at this. And I wasn't certain yesterday was the actual update. It wasn't. We're not going to read through the states, but take a look here. Now, you saw what it looked like before, because I hit the refresh right here, and a thought in my mind occurred to me that, let's show this and let's refresh it. So you saw where it was before. We didn't have much yellow and orange on here. And yellow and orange is where virus levels are going up. In this case, it's flu and COVID. Yeah, no region of the United States is spared. Even the West Coast, we now have some yellow showing up. We have some oranges. We have some very high scores. Look at that. Overall, acute respiratory illness score in Louisiana, 7.99. District of Columbia, 6.69. Puerto Rico now at 6.57. You get the idea here. Things are going up. Okay, things are still somewhat okay in Alaska. Look at that. Hawaii has quickly gone up. You get the point here. We don't have enough time to sit here and go through all this because we got a lot more to get through next. Skipping over that cold weather that's coming. We're not going to look at that today. We'll look at that again another day. If you're in the Northeast and the Midwest, you know it's been very cold. And cold weather leads to virus outbreaks. All right. Wastewater viral activity level in Canada COVID-19 is moderate, flu A is high, flu B is low, and RSV is moderate at this time. I'll look and see if we have anything else for Canada in tomorrow's update, which I should tell you now, it's looking to be an Out in the Wild update tomorrow. So for all you fans of the Out in the Wild update, tomorrow is your day. It's just going to have to work out that way tomorrow. All right, air quality's next. We already refreshed it, but let's just pause anyhow. Hydration break time. The West Coast is dealing with some really bad air qualities in California. There's actually some news stories suggesting that if you have problems like, COPD, asthma, or whatever, maybe you should just not go outside. Take a look at this. Sacramento, really bad air qualities going on out there. Please be careful in that area. Portions of Canada and into the Great Lakes also dealing with problems. Even portions of the Southeast and the East Coast. Florida, not bad, unless you're on the Panhandle, where there are some moderate issues. But again, the worst that we are seeing is clearly on the west coast of the United States. Taking a look at the hospital situation in Pinellas County, Florida, well, actually, the ambulance situation, which could give us some clues to the hospital situation, because we're seeing some red here, which means some ambulances are really getting hung up at the hospitals because the emergency departments are busy. Taking a look at what is going on in Maryland, and oh my, I think we're going to count the number of 4s, and let's remind you what 4 is. 131% or greater of the hospital is occupied. 1, 4, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. I don't know, did I even count that? That's a lot of hospitals. Yeah, there's some ones, but clearly the number of busy hospitals is increasing in the state of Maryland. Taking a look at Philadelphia for yesterday, we saw that there were 753 EMS incidents reported. Doing a live look-in at Montgomery County, Pennsylvania, shows 12 EMS incidents. That's about normal for this time of day. Taking a look at Chester County, Pennsylvania, a little busier than normal. We're seeing a lot of calls. We're seeing respiratory issues, sick person, heat exposure, many fall calls, and a whole bunch of other things. So yikes. That is not good. Taking a look at Bucks County, where 11 was not correct, unless it still is 11. Okay, it's 11 now, too. We actually hadn't refreshed this since yesterday, and turns out it just happens to be 11 calls now, too. We're seeing stroke. We're seeing chest pains. Yeah, a lot of things going on here, and unfortunately, if you think maybe the number of calls that we've been seeing in the Pennsylvania dashboards is going up, you might be correct, because things in Pennsylvania in general are starting to get a lot busier. Let's take a look at this first. Here's the hospital situation where this is spinning around, not updating. Something going on in Lancaster. What's that? Emergency department overcrowding. Well, why might all this be happening? Yeah, I got some really bad news out of Pennsylvania today. Take a look here. Pennsylvania for COVID is now up to the moderate category. Yeah, no more very low Pennsylvania. No more low. Nope, or very low. It's now moderate. Now, I don't know. Did the influenza finally update here in wastewater? It did a little bit. That's starting to go up. How about RSV? Did that update here? No, it didn't. But influenza did. Now comes the really bad news. And let's put this back to the cover page. Influenza activity is increasing rapidly. I've never seen them say that before. I have never seen them actually say, oh no, it's just increasing. No, they're saying it's increasing rapidly. They're saying RSV is increasing rapidly. And they're now saying COVID-19 activity is increasing. Doesn't say rapidly yet, but it could change that pretty soon. Yeah, Pennsylvania is really getting bad in a hurry. Influenza, 7,125 laboratory-confirmed cases already this season up to December 6th. Mind you, that doesn't include these at-home tests. When my dad had flu A, yeah, that doesn't get reported to state. It was on one of these tests right here. For the week ending on 12-6, the percent of emergency department visits with influenza diagnosis is low for all ages statewide. I don't think that's going to be saying low much longer. For the week ending on the 29th, there were 239 new adult hospital admissions and 87 new pediatric admissions. That's a really high number. Now, we're not seeing deaths here. I don't know if Pennsylvania's had any yet. They're not talking about deaths here. RSV, again, is increasing rapidly. 1,663 laboratory-confirmed RSV cases have been reported season to date in Pennsylvania. Emergency department visits for, they're saying that's low. I don't know what the threshold is to get any of this up to moderate, but It probably will eventually. For the week ending on November 29th, this is behind, there were 56 new adult hospital admissions and 63 new pediatric admissions. I suspect influenza and RSV to see a significant, huge increase in hospitalizations probably in the next few weeks, considering we're still looking at, this is data from the 29th of November, and we see how much cases are going up. Also, COVID trends, there were 286, ooh, that seems like a lot, 286 new adult hospital admissions and 13 new pediatric hospital admissions. There is one other thing I want to take a look at on this dashboard, and that is the weekly summary. Take a look at this. Is this set up for, influenza A, flu B, and RSV? So we can see here the number of cases each week. And just in the last week, there have been 2,315 reported cases of flu A, 120 flu B, 466 RSV. When I'm saying reported, it could be from the emergency department. It could be from urgent care. I don't know if any cases from being tested at home get reported to the state. Maybe some do. I honestly don't know, but this right here alone is telling me urgent cares, emergency departments are getting very busy. I've been starting to look at Google busyness trends as of lately, and yeah, the charts are saying way busier than normal at a lot of different places. All right, moving on to New Jersey now, where we do see patient volume problems. Capital Health Regional Medical Center, the emergency department is on divert for patient volume. Cooper University Hospital, full and total divert. Specialty issue at Inspire Medical Center, Mannington. Penn Princeton Medical Center is full and total divert for patient volume. Robert Wood Johnson University Hospital, full and total divert for patient volume. And thankfully, there are no more. Moving on now to New York State. 248 people have tested positive there on the most recent update. And taking a look, we cannot take a look at hospitalizations. Quickly taking a look at some things here from Wastewater Scan, where we do have several changes. The South is now medium for COVID. The Midwest is now up to high, and the Northeast is also now up to high. When we take a look at influenza A, we do see nationally that is now listed at medium, mainly because the Northeast is listed at high, but there's a lot of other high sites here mixed in where it says low, so that's not good. RSV is also listed high. I don't know why this map is not showing any medium or high locations, but they are nationally ranking it at high. EVD 6.8 is now high. Apparently that is really going up big time in California. And of course, norovirus is just high across the entire United States. Yikes. That was a lot of stuff that we went through today. And tomorrow's going to be out in the wild, so it's going to be notes, but I got a feeling my notes are going to be more than one page tomorrow. I don't know. We'll see. If you enjoyed today's video, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. Leave your comments down below. Ways to support the channel are down below. And, of course, listed in the description down below is all my social media pages. I will probably be sharing a ton of things on social media this evening because I told you earlier, I stopped my searches earlier. I need to finish my searches, which is going to probably show a ton of things. Alrighty, folks. I'll see you again tomorrow. Until I see you again tomorrow, please stay safe. Things are really starting to get bad. See you tomorrow, and thanks for watching. Have a fantastic Tuesday evening.